is the role of parents in kids' recovery?
After many years of research, when we really we weren't really focusing on parents, we were just looking at what the outcomes were. We included some measures on parenting and parent mental health, and what we found was that in fact parent mental health is one of the best predictors of social outcome in kids. So with time, parent function actually has an increasing impact. So initially less impact, but then say by 3 years and then 5 and 10, there's an increasing impact of parent anxiety, stress, depression. And I suppose just more recently we've looked at that in concussion, which is obviously a very mild form of brain injury, if there's even a brain injury at all. And surprisingly, even in that group, we can predict the kids who will have delayed recovery based on their parents' anxiety levels.
Right.
So I suppose having found that, what we then thought about was parenting is probably one of the few modifiable risk factors in looking at improving outcomes. So if we can help parents to understand and cope with their child after brain injury and all their behavioural problems, then we hopefully get better outcomes for kids. So that's what we've been doing more recently.
Mm-hmm. Right. Okay. And so is it the case that it's parents' reaction to the brain injury that's causing the problem, or is it the other way around? Do you have any sense of what's causing what?
So we do. We've looked at parents of kids with a whole range of diagnoses. So kids with cancer, kids who need cardiac surgery, and just any kids that have severe enough medical problems to be admitted to the ICU. And we've looked at parents prospectively in those cases, and what we found is that parents who are more anxious beforehand actually become more anxious after, and so they're vulnerable. And then in the kids with TBI who have ongoing problems, their mental health deteriorates over time. That's not a blanket statement. So there are a number of different paths that parents' anxiety can take after their child's diagnosis or their child's injury. Some parents obviously cope perfectly well, but in the parents who have anxiety, it will either increase over time or it will stay stable over time.
Right.
And so now we're looking at
the difference.
Yes.
Right. Okay, that's really interesting.